At the University of Arizona College of Medicine, Phoenix, we have a rural track. We call it the Rural Certificate of Distinction, and it is designed to get our students beyond the walls of this institution out into Arizona, which is largely a rural state. We are a state with huge areas that are underserved. We send students through a broad sweep of Arizona, from the southwest to the northeastern reaches of Arizona, where the residents don't have running water, where they don't have electricity, where there's a scarcity of healthful food, and then, of course, where there's no access to medical care. We have a mission to serve all of Arizona and to help with those inequities. And so I feel like it's a very special role that this rural program serves in the context of a bigger educational mission. Hopefully, generate an interest in coming back to practice in a rural setting when they're all done with the process.
Just the unique circumstances of being in those hospitals and being surrounded by so many compassionate people, I think has sort of rubbed off on me and has allowed me to learn more about compassion, learn more about things that I wouldn't have been able to, not only about myself, but about others. And these are things that I'll take with me for the rest of my life.
One of the main roles that we serve is to help nurture an interest in rural practice, create a program that actually puts the students in a rural setting for clinical training, for a longitudinal experience where they develop professional associations with the local physicians and medical staff, where they can nurture family relationships that may already exist in that community. And we're continuing to evolve, and we're taking it, I believe, to the next level, which is to create an LIC, a longitudinal integrated clerkship, which in effect creates a threaded, continuous educational experience for the students in multiple medical specialties. That kind of impact, I think there's a lot of hope that we can make a difference in terms of the shortages and providing and developing future physicians who are really of the community and therefore going to be so much more effective in taking care of the community. This is an opportunity to really expand horizons, to really understand the conditions of the entire state. We have 21 tribal nations. We've got rural mining communities, and all of them are so unique and so different, facing their own challenges. And what I hope that this program brings to students is the opportunity to get to know their fellow Arizonans who come from very different backgrounds and experiences.